Hello, my name is Stephen Finnegan. I will be a junior at Avon Lake High School. I worked at the Department of Pathobiology in the Lerner Research Institute in the Kerwin lab. The compartmentalization of fat depots correlated to the markers of metabolic syndrome with an emphasis on visceral adipose tissue is the title of my presentation. Metabolic syndrome is a clustering of multiple risk factors. These risk factors are known to increase the chance for type 2 diabetes, mellitus, and cardiovascular disease. These are the multiple risk factors in metabolic syndrome. They include waist circumference, triglycerides, HDL, blood pressure, and fasting glucose. Metabolic syndrome's cause is unknown, although insulin resistance, the amount of visceral adipose tissue, or VAT, genetics or environment might play a role. VAT is thought to be an underlying cause, although subcutaneous adipose tissue is thought to be protective. This is an example of a CT scan or computerized tomography, and as you can see, between the red and the green is the subcutaneous adipose tissue, or SAT, and it is farther away from the organs, showing that it would be a protective and better storage space for adipose tissue and fat. However, in the yellow, in the middle, with all the organs, is the visceral adipose tissue. With the visceral adipose tissue being so close to the organs, it is no surprise that it could be potentially harmful and cause metabolic syndrome. No study before has assessed metabolic syndrome severity and the various fat depots in obese men and women. This knowledge could be used to help prevent or treat metabolic syndrome in the future. We hypothesize that VAT and the metabolic syndrome severity would have a positive correlation, and that the amount of subcutaneous adipose tissue and metabolic severity would have no correlation. We looked at 51 obese individuals, and we divided them into two groups using the criteria from the National Cholesterol Education Program Adult Treatment Panel 3. We divided them into groups either with or without metabolic syndrome. These are the criteria we used to determine whether they had metabolic syndrome. It varies between men and women, and you can see how it varies between waist circumference and how it also varies between HDL. We use the metabolic syndrome Z-score to calculate the metabolic syndrome severity. These are the various Z-scores for men and women, and there is again the same difference between waist circumference and HDL, as you can see. We decided to go with the Z-score to test metabolic severity rather than just the number of risk factors like previous studies, because the Z-score would show if someone had 3 of the risk factors, but they were rather unhealthy, it would show up more in the Z-score than if someone had all 5 but were all borderline. Visceral adipose tissue, the various adipose tissues were determined using computerized tomography and fasting glucose HDL, and triglycerides were determined by blood draws and then analysis of the blood. We used a blood pressure cuff to determine the two types of blood pressure, and waist circumference was measured using a tape measure a few centimeters above the navel. This is a characterization of our group, and you can see higher BMIs in the metabolic syndrome group than the normal group with significance. And you can also see that with triglycerides, diastolic blood pressure, and fasting glucose. HDL is also significantly different, although HDL is lower in the metabolic syndrome group than in the normal. This shows the difference in the amount of fat in each group, and you can see there's a significant difference between the amount of visceral adipose tissue in the metabolic syndrome compared to the normal, while for subcutaneous adipose tissue, the metabolic syndrome group and normal group have almost the same amount. This graph shows visceral adipose tissue correlated to metabolic syndrome, and you can see that it has a strong correlation of 0.674, while it is also very significant. This means that increased visceral adipose tissue increases the metabolic syndrome z-score. This graph shows subcutaneous adipose tissue on the other hand, where subcutaneous adipose tissue and the metabolic z-score are not significant. This means that subcutaneous adipose tissue is not related to the metabolic syndrome z-score. In conclusion, the visceral adipose tissue is a good marker for metabolic syndrome being present and more severe because of its significantly high correlation. Subcutaneous adipose tissue, however, is not correlated. So visceral adipose tissue is a suggested marker for metabolic syndrome, and it is possibly related to triglycerides, HDL, and diastolic blood pressure and fasting glucose, which could be the reason that there were significant differences in those variables between groups. We would recommend that a study would be made to find by which visceral adipose tissue contributes to metabolic syndrome, and also a study that would look at treatments that reduce visceral adipose tissue and see possible reductions in metabolic syndrome z-score. Also, a future study should examine the insulin resistance correlated to metabolic syndrome and also related to visceral adipose tissue. I would like to thank the Kerwin Lab for all their support, especially my mentor, Julianne Fillion, and I would also like to thank the whole Office of Civic Education Initiatives for putting on this program, especially Ms. Starling and Ms. Strickland for all their hard work.